Hi everyone, let's talk honestly today about something most doctors don't discuss openly and most patients hesitate to ask. So if you are diabetic or know someone who is, this video might change your perspective on something that affects your everyday quality of life, your bladder health and your sexual functions. Yes, diabetes does not just affect your sugar, it affects your nerves, your sensations, even your confidence silently but surely. Autonomic neuropathy and diabetic cystopathy. Let's begin with the bladder. Most people think that the diabetes and think of the kidney, but do you know that the diabetes also damages the nerve that controls your bladder? This is known as autonomic neuropathy. The results, a condition known as diabetic cystopathy, also affect the bladder. It starts silently. You may not feel the urge to urinate as frequently. You may start leaking a small amount of urine, especially at night. In a landmark study published in Diabetic Care, up to 43% of the long-standing diabetic patients show signs of impaired bladder functions, yet most of them are unaware of it. That's why I tell my patient, if you are diabetic and your bladder habits have changed, it is not aging, it is your nerves. Let's address a topic that men hardly talk about, that is erectile dysfunction. You will be surprised to know that 50% of the patients with diabetes experience erectile dysfunction. Let's break it through and how does it happen? Nerve damage, the same autonomic neuropathy that affects your bladder can also decrease the brain signals to the penis. Now the second part is endothelial dysfunctions, which is the second most common of the erectile dysfunction. Now the third is the low testosterone, because diabetes can also disrupt the hormonal levels. But here is the good news, ED in diabetes is treatable. And in fact, 2022 review in the Journal of Urology shows that the diabetic patients who received early evaluation and treatment of the ED has a better outcome, not just sexually, but also psychologically and relationally. I always say diabetes is not just about sugar, it is about other systems. It can affect your heart, your kidney, your bladder and your bedroom. But here is the power to you. Early intervention, whether it's a urodynamic study, penile color Doppler, nerve testing studies, modern medicines, all are going to allay your problems. Talk to your urologist, get evaluated, reclaim your confidence, because sometimes a small conversations can change life. Thanks.